Alright, so let's talk about pediatric vascular anomalies. Now, pediatric vascular anomalies from the name there are abnormal things going on in the blood vessel that especially occur among infants at birth. So pediatric vascular anomalies, there are so many types that you divide them into two groups, alright? The first group is the vascular tumors, and the second group is the vascular malformation. What is the difference between the two? Well, from the name, vascular tumors are tumors in which you have abnormal cells that proliferate. You have a tumor. And as we know, a tumor can be benign or malignant. Some of them may be localized, which is known as a case of benign, and some are metastasized, such as a case of malignant tumors. But in the case of vascular tumors, there's so many types, but so to the point that we're just going to focus on just the most common type of benign vascular tumors among infants, and that is infantile hemangioma. And typically with vascular tumors, as we said with any tumor, they constantly proliferate without stopping. So if we don't treat the patient, it will grow in size. It will not stop. And the thing about vascular tumors, a lot of them end with oma. So you might hear the term angioma, right? That involves a tumor involving the blood vessel, angioma, fibroma. But we're going to focus on just one type of vascular tumor which is benign, and that is infantile hemangioma. While the second group is vascular malformation. In this one, the growth actually stabilizes. Here, there's no form of tumor. There's no constant proliferation or whatever. Here, the thing about it is that you have an abnormal lesion in the blood vessel. There's an abnormal lesion in the blood vessel, or there's an abnormality in the structure of a blood vessel that appears as an abnormal lesion from the outside. So that's what vascular malformation, that's what it means. And there are many types of vascular malformation. However, we're going to focus on the two most common types that affect at the level of the capillaries, and that is nevus simplex, or they call it salmon patch, as well as port wine stain. Okay? So that's what we're going to talk about vascular malformation. And remember, the growth is stable here. Even if you don't treat, eventually over time, it can resolve itself. Sometimes, not all types, some of them. Okay? So now let's talk about each of them one by one. Let's start with vascular malformation. Now again, these vascular anomalies, they occur at birth. Okay? You typically see them appear at birth or after a couple of months. So let's start with the vascular malformation at the level of the capillaries. We have nevus simplex or salmon patch, and we have port wine stain. You see, with nevus simplex, this is what I had when I was a child. Nevus simplex is a misnomer. From the name, you could assume this is related to melanocytes, right? Nevus means a collection of melanocytes, but this is actually a false name. This is what they used to call it, but really another name you could call it is just the same meaning, known as salmon patch. Now what is salmon patch exactly? It is basically a capillary vascular malformation. You have a malformation at the level of the capillary. And because it is capillary malformation, the baby may appear to you, or when I used to appear as at birth, they may appear to you with a patch at their forehead. They might appear to you with a red erythematous patch, alright, that is in the midline of the forehead. It could be in the midline of the forehead. It can also extend to the upper eyelid. Alright, and that is what a salmon patch is. It's basically a benign, very benign skin lesion that appears as an erythematous patch, maybe with irregular borders, that is seen in the midline of the forehead, and it can also be seen in the upper eyelid. And you can also see it in the scalp as well. And in the case of this one, this nevus simplex, you can diagnose it clinically. It doesn't need anything specific. And the thing that's good about it is you can see this baby, he's smiling. He's smiling, indicating that the prognosis and the treatment is good. The treatment here is just reassurance. You see, typically you don't do anything. You just tell the patient, or what they told my parents, you just tell that this baby, he has a salmon patch, and it is very benign, and it will resolve itself after 1 to 2 years. So treatment is unnecessary. You don't have to do anything for the patient. You can just wait for it to resolve. And it resolved, in my case, it resolved after 1 to 2 years as well. Okay? So that is what salmon patch is. This is a good one. This is just a benign thing that you might see in a baby with a erythematous red patch in the midline of the forehead or extending to the upper eyelid. Okay? Now what about port wine stain? Now port wine stain is the same. It is the same as nevus simplex or salmon patch, but here the prognosis and the treatment is the opposite. Here the prognosis is bad in regards to treatment. And here the treatment is not reassurance. You have to do something. You have to do treatment either cosmetically or in the form of a laser. You have to apply a laser to the lesion. Now you see, in port wine stain, the term port wine means like whenever somebody stains their t-shirt with wine. Somebody drinks wine or alcohol and they stain their t-shirt with wine, they give the color pink, right? Well, it's the same idea, as if the baby has his face stained with wine or alcohol. And this gives the appearance of a wine stain. And you see, the appearance is basically the same as nevus simplex. You have an erythematous pink to reddish patch, alright? And the difference here is this reddish patch never ever occurs in the midline. You see, this baby is sad. The prognosis treatment is bad. That's number one. And number two, it does not occur in the midline. It occurs maybe in the cheeks. Alright. It can also occur in the forehead, but in the temporal area of the forehead. Right? It can occur in the scalp, which will never occur in the midline. That's a key difference. If you see a reddish patch and you suspect port wine stain, you should make sure it does not occur in the midline, because that might be instead salmon patch, which is basically a good thing. That does not need treatment. But in the case of port wine stain, no, this does need treatment. Okay? So this is the difference between the two. They have the same clinical lesion, which is the erythematous patch. One occurs in the midline, one does not occur in the midline. One just needs reassurance, the other does not need, one does not need reassurance, the other does need reassurance. What I'm trying to say is port wine stain is bad, alright? That needs treatment immediately, but nevus simplex, no. Okay, now that we've got that out of the way, the diagnosis is again clinically. You can take it clinically. Baby comes to you with a painless lesion. The parents just tell you he has this patch in his head. So you can say this is a case of port wine stain. And the thing, why do I keep saying, why is this prognosis bad, right? Why is treatment necessary for port wine stain unlike salmon patch? Well, the reason why is because this lesion right here, unfortunately, it never stops growing, all right? Here, it never stops changing its form, or it never stops disappearing. That's the problem. You see, this lesion, it can appear as a patch, or over the years, it can appear in the form of papules. It becomes a vascular papule. Some of this lesion, they could thicken. Some of the skin may hypertrophy, and they may darken over the years. And you might see the presence of eventually papules, or the appearance of eventually nodules. Right? You might see the appearance of little nodules as well. And you might see the appearance change constantly over time throughout the years. But it's not really the biggest problem. The biggest problem is that it never disappears. This one never ever disappears, even with treatment. It's constantly what? Reoccurrent. And that's the bad thing about it. That's why the treatment is constantly, we have to treat it. Because here's the thing, if you look at pictures of babies with port wine stain, it's an ugly scar, right? It's an ugly lesion. And that's what the problem is. It's a very ugly lesion on the baby. He can't get bullied during life. So you do treatment for him necessarily in the form of cosmetics or in the form of laser. You have to do a laser, which is known as a pulse dye laser. You apply a laser on this lesion and you will ulcerate this part of the lesion and the abnormal blood vessel without affecting surrounding structures. But the thing about this laser, if you apply it in this laser right here, and you apply it in this abnormal blood vessel, while not touching the surrounding normal blood vessels, the thing about it, even if you apply this laser, it will appear again. It will come again and again and again, right? So you have to get constant laser treatment for this scenario in order for it to disappear throughout your life, because if you don't get it, it will appear again. That's why the prognosis is bad, and that's why treatment is necessary for port wine stain. It is a hideous, really a hideous lesion, an ugly lesion, that constantly requires treatment because it is recurrent, okay? This is unlike salmon patch, okay? That's why the baby is sad, the baby is happy here, okay? Now that we finished with the capillary vascular malformation, that's all we have to know. Now that we finished with the capillary malformation, let's now talk about vascular tumor. And when we talk about vascular tumor that end with an oma, the one that constantly proliferate, even with uncontinued treatment, let's talk about the most common one. The most common one is infantile hemangioma. From the name, we have a case of a tumor, right? Hemangioma, we have an abnormal tumor, whether benign or malignant. And this one is benign. And this benign tumor occurs in infants during birth. And this is a benign tumor in which the tumor, it likes to proliferate during the first 2 to 3 months of life. And what is the clinical presentation of a child with infantile hemangioma? Well, the clinical presentation is this child may appear to you in anywhere in his body. in his face, in his trunk, in his shoulder, anywhere in his body, he may appear to you with a patch, an erythematous patch. So you see this lesion right here? This is a patch. And this patch is reddish or pinkish in nature. They give it a specific type of hemangioma. They call it superficial type of hemangioma, where you have a reddish superficial patch, all right? And this superficial patch may occur anywhere in the body. And whenever you see a reddish, any lesion that's reddish in color, you try to press it, right? You want to differentiate it from erythema. So when you try to press it through a blanch test, when you press it, it doesn't disappear. This means that this patch is non-blanching. This means there's blood vessels involved, and this is not a case of inflammation. So as we say in case of infantile hemangioma, a baby may come to you with an erythematous, non-blanching patch, a patch that does not disappear with pressure. A non-blanching patch that is reddish or pinkish in nature, and you can see this especially in one type of infantile hemangioma, which is superficial type. And you can see also surrounding this patch reddish colors, right? You can see a color red, a color white, color white, color red, white, red, surrounding this patch. Basically what this means is that this patch is characterized with areas of pallor, or areas of vasoconstriction. So you can see in a patient a patch, and surrounding this patch is areas of pallor. Some of the blood vessels are vasoconstricted, and some of them are not. So you can see some that are vasodilated, some are vasoconstricted. Vasodilated, vasoconstricted. Areas of pallor. And these are also characteristic features you might see in a patch in case of infantile hemangioma. Okay? So this is the most clinical, really the most common clinical presentation you'll see in infantile hemangioma. It's harmless, typically, and it can be, as we said, localized or dermatomal, anywhere in the body. It can be localized anywhere in the body, or it can be distributed dermatomal, in a dermatomal pattern, in a linear pattern, anywhere in the body, all right? So this is basically infantile hemangioma. The patient may typically be asymptomatic unless the tumor continues to proliferate and it starts to obstruct something. Like it can obstruct the voice box. That is a very, very bad complication. It can obstruct the voice box or the larynx. It can also obstruct the eye. If it obstructs one of the eye, this is bad. It can lead to development of amblyopia, lazy eye, for example. Or this can be another bad prognosis is if this infantile hemangioma, this is part of a syndrome, one of these congenital syndrome, and this is also another bad scenario for the baby, right? Or it could be ulcerated. It could grow a mass, and this mass can ulcerate, and again, this can be also bad for the baby, right? In terms of treatment. So there are typically scenarios that can make infantile hemangioma bad in terms of prognosis, with the following complications: affection of the larynx, affection of the eye, ulceration. Is it part of a syndrome, congenital syndrome, or is it benign? Or is it really a case of cosmetic? Like it could be very, very bad cosmetically, right? It could be hideous in appearance. So these are things that where we really consider it as a bad prognosis, and they will require necessary treatment, right? But most cases with infantile hemangioma, it is typically mild, and in really best case scenario, it can resolve itself. But really, you don't have to rely on that. You have to refer to a dermatologist as a GP or to a vascular surgeon where you treat this patient immediately. Because if you don't treat it, it will proliferate. So reassurance is out of the question, okay? So this is the clinical presentation of hemangioma, and there are types according to the clinical presentation. The one I just explained in this one, I refer to the superficial type, the reddish pinkish patches, right, superficially. There are other types like deep and mixed. The difference between superficial and deep is in the deep, you don't necessarily have a patch. You have a patch that eventually evolves into a papule. They evolve into a raised lesion, a papule, and it becomes large, an elevated lesion, and eventually you might see it elevated in that region. This is known as a deep infantile hemangioma. This is ones where you have to refer to a vascular surgeon for treatment in such cases. So this is the difference between deep and superficial. You might see a patch eventually become elevated. It becomes a papule essentially. And it might become bluish in color. Instead of red, it might become also bluish in color. So that's the meaning of deep infantile hemangioma and the difference from superficial, the opposite. In superficial, it is flat lesion that is reddish in color. But in deep, it becomes raised and bluish in color. And in the case of mixing, it is a mix of the two, superficial and deep. Of course, the type that we want, the type with the best prognosis and the best response to treatment is the superficial type. That's what we like to see. So these are with the types. The one I focused on mostly is the superficial type with the non-blenching patch. Now what about the complications? We already mentioned about complications as before. And that's why, if we were to compare everything, if we were to compare infantile hemangioma with salmon patch and port wine stain, and we were to ask ourselves which one is most severe, we'll say really infantile hemangioma because of the syndrome, if it's associated to a syndrome or not. But which one really has a more hideous scar? It is port wine stain, right? And it's reoccurrent, that's why it has a bad prognosis, right? And if we say something that really does not need treatment, it is salmon patch. This is one that just needs reassurance. It does not need any treatment, okay? But let's say something, which of these three responds to treatment very, very well? Well, it is infantile hemangioma, and that's what we're going to talk about now. And it's the management of infantile hemangioma. Now, the treatment can be topical or systemic. If you have a superficial type of hemangioma, you can start with topical medication. You can start with topical beta blockers. You can give beta blockers, and the cause as to why they might be beneficial, but the idea with beta blockers is they can, in the case of superficial type of hemangioma, topically, you can give beta blockers and they can resolve the tumor. Or you can also give this patient corticosteroids. You can give them topically, or you can give it intralesional, directly into the lesion corticosteroids. And you'll see this is not exclusive just to infantile hemangioma. You'll see this in keloids, you'll also see this in alopecia as well, certain types of alopecia. Besides corticosteroids, you can also do the pulse dye laser. And we've seen this laser in the case of port wine stain. You can also do pulse dye laser, the same laser as this one. Again, you apply a laser at the lesion and you ulcerate this lesion specifically without touching the surrounding structures. So you can use it in case of superficial infantile hemangioma, and you can use it in the case of port wine stain. Okay? But remember, these topical medications, beta blockers, corticosteroids, pulse dye laser, they begin given topically or really at the superficial type, or really superficially at the skin, regarding the superficial type of infantile hemangioma. So if you have a superficial infantile hemangioma, you can give topical beta blockers, topical corticosteroids, or a pulse dye laser. For example, let's say we have a case of a patient who has deep infantile hemangioma, or has any of the complications. Let's say I decide that this patient does not have a superficial type, he has a deep case of infantile hemangioma, or infantile hemangioma complicated by something else. Then you can refer him to a vascular surgeon, or as a dermatologist, you can choose the following options. You see, in deep or other causes besides superficial type of infantile hemangioma, here you can use systemic therapy. Topical therapy, no. You'll use systemic therapy of the same medication. So you can use systemic beta blockers, systemic corticosteroids, or you can use, in this case, instead of a pulse dye laser, you can use immunosuppressives as well. Maybe before you refer as a dermatologist, before you refer him to a vascular surgeon, for example, you'll do an immunosuppressive. You'll give this patient immunosuppressive to prepare for him before the meeting with the vascular surgeon, right? So you can also give immunosuppressives as well, or antineoplastics, for example, like vincristins. Really vincristins, and instead of regular immunosuppressives, let's say antineoplastics, like vincristins. That is for the systemic part of the therapy, systemic part. But for the topical, these three right there. Systemic, beta blocker, corticosteroids, and immunosuppressors or neoplastics, or anti-neoplastic agents such as vincristin. And again, the systemic therapy indicated in any case that's not superficial type of hemangioma. If you have a superficial type of hemangioma, something benign, something easy, you can start with topical therapy of beta blockers and or corticosteroids and or pulse dye laser. That's pretty much it, and that's the one that is very responsive to treatment. And that's pretty much it for the pediatric vascular anomalies, some of the more common types. Thank you.